Experience holiday cheer at Tanger Outlets with savings up to 70% off your favorite brands. From fragrances to accessories and the latest styles, discover the best gifts for everyone on your list. Save big at Nike Factory Store, Michael Kors, Under Armour, Coach, Polo Ralph Lauren, Kate Spade New York, and so many more. Unwrap the best at Tanger Outlets. Hundreds of brands, endless gifting options. Plan your trip at Tanger.com.
Joining us since the pandemic began, and we are grateful for him being part of the show, is our good friend Dr. Dennis Norem from Mercy Health to continue the COVID conversation. Dr. Norem, good morning to you.
Good morning to you guys.
95 sound all right for you tomorrow?
It sure beats 108 they've had in Tucson. But so fortunately I'm here, and I'm glad to see it raining.
Yeah, we are well in need of it, and 108 or 118 and all that that area with 16% humidity, a lot different than it is here.
Yes, indeed.
All right, so let's see. Where do we stand? Here's a question that actually alert listener Mike had sent me this question, wanted me to ask you this one right off the bat. How is it you know if you have the Delta variant of COVID-19?
That's a good question. I don't have a real good answer to it, except to say that, again, the health department through the state does surveillance of the positive patients here in the community. And overall, across the country, it looks like it's about 80 to 90% now Delta variant. I just looked at Winnebago County's website. They say the Delta variant is the predominant variant. They don't give a percent. So it's done through surveillance. So not everybody who is positive gets tested, but they take samples and they extrapolate that based on the percentage of the samples. So if they, sample maybe a few percent of all of the positive ones that are coming in, if they're all Delta, then they extrapolate that and say, okay, it's predominantly Delta.
All right. According to the CDC, if you're testing positive in the summer of 2021, which is where we sit, you likely have the Delta variant. The CDC is estimating that 83% of the current cases in the U.S. are Delta.
Yes, and again, estimate. So for an individual, it's very difficult to know whether they have the Delta variant. However, having said that, if you've been vaccinated and you get COVID, I think it's pretty safe to say that you have the Delta variant.
Oh, the Delta variant is what's breaking through the vaccine wall, generally?
Generally speaking, yes.
Okay. And what's the other variant that we're hearing about? Is it Lambda?
Yeah, Lambda. That's an interesting variant. Lambda was first found in Peru, apparently. And I think the most recent statistics I saw that they estimate there's maybe been 1,000 cases of Lambda floating around the United States. They're not sure the significance of the Lambda variant, except to say that it may be a little more resistant to our vaccines. And it's probably more infectious than the original COVID virus. However, one of the epidemiologists made an observation, which I think is important, that it's been around for quite a number of weeks, and it's not really breaking through. Everything seems to be dominated by the Delta variant, so we don't know what's going to happen with Lambda.
So one of the other things about Delta, obviously, it's a little bit more contagious. It's breaking through vaccines. It also appears to be attacking or affecting some of the younger population. I think we have a couple hundred of children in hospitals down south. Have we seen it creep down into kids around here? And why? What is the difference between, how does it get to kids now that it didn't before?
Well, I think it is more infectious, more contagious, and our kids are not vaccinated, generally speaking. We're just starting to be able to vaccinate some of the older kids. So I think this is how you would expect the virus to go. It hits the most susceptible people first, and now it's going after the people who maybe are less susceptible but are unvaccinated, and being unvaccinated makes them a little more susceptible. So we're seeing it more in kids, and it's a little discouraging because we're seeing a more likely that a child would be hospitalized with this Delta variant than we saw with the original COVID.
All right. It's hard to keep track, and I think it's hard to keep track for the average layperson when you keep hearing Delta variant, because that's what we're getting we're getting hit with every time that the topic rolls around. But for the average person to wrap their head around, okay, this is which variant? This could be Lambda. This could be the regular. This is the Delta. I don't know which one it is, and saying, well, I just took a test. Tell me what it is. Doesn't really work that way.
No, it doesn't. You just can't go in and to your doctor and say, tell me which variant it is. And again, that takes a few days, and it's a sampling situation. So we just have to go based on percentages. So I think people who come down with with COVID can be pretty sure that they're 80-90% likely to be the Delta variant right now.
Dr. Norem, something else that's kind of jumping out, the Associated Press talking about this morning, some in the U.S. are getting COVID-19 booster shots without FDA approval. They use as an example a woman who decided not to take any chances after reading about the Delta variant. She went in and got a third, what she called a booster shot of the COVID-19 vaccine by going to a clinic and telling them she had not been inoculated yet. This was her first shot. And apparently, she's not the only one who's doing it. Healthcare providers across the country are reported on more than 900 instances of people going in and getting a third dose of COVID-19 vaccines on their own, deciding for themselves that they need a booster shot and deciding to take those measures in which to get it.
I think that's a bit unfortunate that people would do that. You should be honest about your health history. It's probably likely that we're going to need booster shots. I think the people in the FDA are saying not yet, that isn't quite there because we haven't decided who should get them first. Obviously, people with lower immune systems, older people, may need the booster shot, but we're not there yet. And we need to get the people who aren't vaccinated first. So I would hope people wouldn't do that, but, that's human nature. It's just like what we've talked about when we dropped the mask mandates, that people who are vaccinated didn't need to wear a mask. Well, you know how that goes. People just don't tell the truth sometimes, but I'm not sure what we do about it.
Yeah, in this case, one entry in the CDC database shows a 52-year-old man got a third dose from a California pharmacy by saying he'd never received one and by providing his passport rather than his driver's license as an ID. But when the pharmacy contacted his insurance provider, they were told he'd already gotten his 2 doses in March and sent him on his way. A 39-year-old man in Virginia got a third shot from a military provider after he showed a vaccine card indicating he'd only received 1 dose. A review of records turned up that he had gotten those and that he had doctored his vaccine receipt.
Yeah, I would ask people not to do that. It just is not good, and it's difficult for us, for healthcare providers, because when we do come out recommendations for people to have a booster vaccine and they show up and then you find out they've already had one, is it then the right one? It just creates many difficulties for the healthcare providers.
Plus, they haven't really run any testing on what sort of side effect or anything you might get from going with a third dose that you didn't need.
And I think that's part of the data's not in yet. We're not 100% sure. They're doing some. They're obviously doing a few studies on the booster. And as we've talked about before, which booster? Do you get the booster of the same vaccine that you've already received, or there's evidence suggesting you should get a booster from a different type of COVID vaccine? So before those issues are settled, we just can't make recommendations about boosters.
Will eventually, if a booster does come along, will the same decision process go into what's going to be involved in this booster as we do every year for the flu shot, where there's like the prediction of what's going to be, or will we be predicting what we're going to fight with coronavirus, or fighting what's already out there?
It's probably going to be more to fighting what's already out there. You bring up a good point. The flu vaccines are based on what we see for the current season, and actually look in the southern hemisphere to see what the flu strains that are going down there, to try to predict what we're going to have in the next season. So they kind of try to predict ahead. We don't know if coronavirus is going to be quite that same situation. And the other thing with the new NA vaccines, it looks like they can turn around a new vaccine that's tailored to a new variant within about 90 to 120 days, which is, I think, much quicker than we can do with flu. So it's going to be a little different. I think the overall issue is trying to boost our immune systems in general, and then trying to come up with some tailored vaccines.
You mentioned that three-letter word, which has me curious, and I read a piece on it the other day, and that's the flu. How do flu shots and all that tie in with COVID-19 vaccinations? Are the flu shots going to be a recommended thing once again this year? Do these two go well together? Does one have an effect on the other one?
As far as I know, excuse me, there's no interaction per se. And I think absolutely we're going to recommend flu shots. The concern last season, and I think it's going to be a concern again this season, is we're all focused on COVID and people are going to forget about flu. And flu is going to be important, especially since we haven't seen much of a flu season. That always makes me a little nervous. You go a couple years and don't have a bad flu season, and generally speaking, you catch up at some point. You get a bad season. So I think there's going to be a lot of push to say, please get your flu shot. And as far as I know, there's no interaction. In other words, no more side effects, no concern that somehow the flu shot's going to interfere with the COVID shot. The flu shot is not going to give you a false positive COVID test. So, yes, get your flu shot as you normally would.
So there's a couple of numbers and stats floating around there that people are having different reactions to, and I want to know how a doctor would react to this, how we should. When we talk about the percentage of positive cases coming from the vaccinated, that number is growing, and I think a lot of times when that number grows higher, some people read that as the vaccine's not necessarily being effective. However, I've heard this explained to me this way. We do know that the vaccine limits the severity of the case, but it can still break through. If 0% of the population was vaccinated, then 100% of COVID cases would come from unvaccinated people. If 100% of the population was vaccinated, then 100% of the COVID cases would come from the vaccinated population. Is there a sweet spot in the number that would be alarming to you if we got to a certain point? And how should people read those numbers about the vaccinated testing positive?
I think the way I look at it, and kind of in a different perspective, we'd like to get to that herd immunity number because that would stop the spread. So I don't know that it's terribly relevant what percent of the population is vaccinated or not vaccinated that gets COVID. I think we're still back to what percent of the population in general is vaccinated overall. If we could get to whatever that herd immunity number is, and it's been kicked around 70%, it's probably higher, 80%, 85%, 90%. It may be with the Delta variant, may be as high as, or need to be as high as 90%. At that point, we wouldn't see these kinds of numbers spiking. We'd have low levels of infection across the population, excuse me, and we wouldn't be having this discussion about how we're seeing this terrible spike. So I think concern's still back to getting people vaccinated.
When you say herd immunity, the immunity part of that phrase would lead me to believe that you can't get sick from it. So are we immune if we're still vaccinated but can contract the disease?
Yeah, you bring up an interesting point. How do you define immunity? I guess we'd have to put it in context now of partial immunity. We're not 100% immune, but as we see, people that are vaccinated get very mild cases. And we think, and we still think, that people who are vaccinated are much, much less likely to spread the variant, even though we're seeing probably some spread from vaccinated patients. So I would still say that we are immune, even though it's not 100%. And unfortunately, in medicine, nothing's ever 100%. That's kind of my take on things.
And then I guess one more follow on that. When you said, a vaccinated person that contracts COVID less likely to spread, is that simply because they're asymptomatic or generally low symptomatic, so we're not getting the sneezing, the coughing, or is there something else, with biology going on that doesn't let them spread it as easily?
Well, I think you bring up a good point that, yes, there's less coughing, they're less sick, there's less probably expulsion of the virus. The other thing that's probably happening is the viral particles that they are expelling are probably not as active. As you may remember, people who are positive for COVID and get COVID, they can sometimes test positive for several weeks afterwards. But clearly, it appears after the 10 to 14 days, they're not contagious to other people. So the viral particles that our immune system attacks probably affects those particles, and they're not as active as they would be as they are early on when you're infected.
Gotcha. All right. See, once again, this is why this segment of the show is so valuable, because we walk away from it every week having learned something new that we did not know before, or another way of looking at it. Dr. Norem, I don't think we're in any danger of solving this crisis over the next 7 days. So as always, we'll look forward to talking to you again next week if you're willing.
I'm certainly willing. See you guys next week.
We'll
Take
look
care.
forward to it. There's our friend Dr. Dennis Norem from Mercy Health.